Today I am going to talk about a very controversial topic, means DHT blocker uses or finasteride uses in male pattern baldness. First of all, finasteride is not a steroid. Finasteride is a testosterone blocker medicine, means it binds with the testosterone receptors present on your scalp to prevent the testosterone hormone entrance in the scalp to give you a nice hair growth. It does not decrease the level of testosterone hormone level in the blood in the males. In fact, this is the only US FDA approved medicine available for male pattern baldness called as androgenic alopecia. Finasteride does not lead to any impotency. Whatever impotency is written about this medicine on social media, that's absolutely wrong. In fact, this is the only medicine which keeps on working in your body for 15 to 18 years without any resistance. And if you'll start having this medicine in your 20s, 30s and 40s, you can easily save your hairs and hair thinning. Once you'll cross your 40s or 50s years of age, obviously chances of hair thinning becomes negligible. Very rarely, finasteride can cause some sexual side effects in 0.05% of patients, like decreased sexual interest or erectile dysfunction, or means that too in one out of 200 or 300 patients, which is very rare. If we'll stop the medicine, the side effects becomes reversible just in 15 days. So why to get stressed when the side effects are so temporary and easily reversible? Just have this medicine and live in present. Topical finasteride solutions are also available in the market, but they are not effective at all. In case of side effects, your dermatologist can try to reintroduce this medicine in a very less doses, like twice in a week or thrice in a week. Or your dermatologist can advise you injection dutasteride locally on the scalp once in a month to give you a nice hair growth. This medicine is so effective, it works very well in female pattern baldness also. If the females are having hair thinning and they are not responding to minoxidil solution, or they are having some hormonal changes, or if they are in their premenopausal age.